So the TPP agreement makes it very difficult for countries to access newer medicines or to access medicines earlier. If you're looking at hepatitis C itself and you look at direct acting antivirals, which are causing a revolution in hepatitis C, and generics are now being developed, if you want to deliver direct acting antivirals for hepatitis C, you need to register them. And if you can't register them because of data exclusivity, it means that you can't have access to those drugs. A number of countries with a very high burden of hepatitis C are part of the TPP: Malaysia, Vietnam, Australia, and it basically means that you're building more barriers to access to treatment on top of patents which already exist.
I've spent the past few years working for different NGOs, but before that, I worked here in Canada as a pharmacist, and Canada depends heavily on generic medicines. So the trade agreement will affect us, and wherever it's possible, then you know, if there are generic drugs available that are not under patent any longer in Canada, then they're used quite widely here. And so I think it's not something that we can point fingers and say it's another country in another part of the world. It will affect us in Canada as well. And the generics that we use here do come from companies that have factories in India, and they are also likely to be made and brought from India.
Yeah, just to add, I think in some ways the Indian system was mirrored on the Canadian system, which had a very healthy domestic generic production of medicines. And if you just look at the cost of sofosbuvir, which is a new acting antiviral for hepatitis C, it costs thousands of dollars in Canada. And the future to scale up treatment in Canada would be to start producing these medicines generically. And one of the ways Canada could do that is to stop evergreening of patents, to prevent data exclusivity barriers from coming in. But however, the TPP directly targets some of Canada's evergreening policies, which has actually led to a very big court case. I don't know whether people are aware that Eli Lilly has sued Canada to sort of not apply evergreening safeguards, which basically means that you take the same drug and patent it for several uses, which the Canadian courts have sort of taken offense to and struck down. Eli Lilly is obviously unhappy with the decision and has sued Canada under NAFTA, and that's not surprising. That's what pharma companies do. But the TPP just sort of makes it worse by forcing Canada to dilute its safeguards. And in I would say this, that I'm starting to talk to Canadians who can't access hepatitis C treatment, and people have a lot of respect for the Canadian health system, and it would be important to sort of probably, if you just look across the border and realize that we shouldn't be adopting, or Canada should not be adopting, the problems that are just right across its own border in the United States.